I think the annual celebration is a very important event to reaffirm our commitment in supporting our employees. Our employees are our most valuable, precious asset.
I was really focused on med-surg, but being part of quality, you actually get to see the different areas in the hospital. It's just fascinating to see the quality that we give for all of our patients. 20 years, wow.
I want to thank all three of them for their loyalty and their dedication to our department and to our moms and our babies. We've created a department here where people enjoy, number one, coming to work. Number two, they love the teamwork and the camaraderie that they feel when they come to work. I think they enjoy their jobs.
What I like the most about the job is that we're like a family and we team nurse.
We don't try to compete with each other, you know. That was nice. Everybody kind of helps each other out. One time, my whole family and brother, sister, we went out and eat in the restaurant, and one of my former patients, she paid for 15 meals, and she left, and then the cashier come and say that your table has been paid, and it's from my patients.
I really enjoy the triage aspect in the radio room, operating between the paramedics and in the field and the department, and being prepared for them when they get here. I like the camaraderie that we have here at community. No one stands alone.
I really like working in the blood bank department in the laboratories. I like working in trauma situations. It feels good to be a part of this family.
I work most of the cardiac unit, and we basically, as they come out of surgery, we try to get them off the ventilators fast as we can. I get attached to them. Sometimes I start to cry with the family.
Started in 1985 as extra help at the Old Valley Medical Center. I loved patient contact, and then I had lost my hearing, so I became disabled. And as far as bedside nursing, so I was very grateful there is a position I can still be useful in my nursing career.
Patients crack me up, and sometimes a family. Because some of them you just try to make them be comfortable in the hospital, and sometimes they get back at you too. And when they're nice and healthy and they know where they're ready to go, and they say something really funny, and it just makes your whole day. And forget the past, but now the present, that you see them happy and makes you happy.
Hey Vic, how you doing? I just wanted to congratulate you on your 25 years of excellent service to the company. You and I have worked together for 6 of those years, and you've always been a consummate managed care professional, and I rely on your sage counsel and your attention to detail all the time. And I love working with you, and I count you as a true friend of mine, and I look forward to working with you in the years to come. Congratulations.
started here in 1985 as a pharmacy runner back then. And my mom helped me get the job because she worked here at the time as a unit clerk. On the more humorous side, when I was about 8.5 months pregnant, and was very large at the time, there was a code blue called on the 4 Central. When I arrived in the room, I was about the second person in there, and the patient was actually on the floor. And it was about this time that I realized, sitting there on the floor, that I needed help getting up.
There's nothing better. This is the absolute best part of nursing, to bring new babies into the world. And even though I've been doing it for 26 years, you kind of get a little emotional and teary with each one because it's such a special event. During my time here, I've delivered conjoined twins, which is extremely rare. I think we've only ever had one set here that I know of. They were successfully separated at Valley Children's. They're healthy, probably 8 or 9-year-old girls now. It was one of the most extraordinary experiences of my life. It was fabulous. I know if I was in an emergency and I needed someone to come in now, all I have to do is push that button and 12 people will come running down to help.
We had a young lady come in labor one night, and she was just very uncomfortable, and first thing she needed to do was to go to the bathroom, and she went into the girls' room, and we heard a little noise, and her husband and I looked at each other, and we flew into the bathroom, and he helped her stand up, and baby was screaming and healthy. I'm here, I love the people I work with, and I love the atmosphere, and who can't love having babies all the time here,
The one thing I like being at Clovis is the interaction of the departments. We're more not just amongst ourselves, but we work as a team with the nurses, with the physicians, with clerical people outside. We're involved in helping a person to overcome some tragedy of some sort, like a surgical situation where they're bleeding out, or in a situation where they're coming into ER, and with the help of our testing and everything, it helps to improve that patient's care so that they could walk out of the hospital.
Carito, I love you. Carrie and I are really good friends. She's been my assistant since I came here. I count on her every day. She is a fabulous asset to the company.
I have worked with some phenomenal people over the years in materials management and now in corporate administration, and I can truly say that these people have been my family. I love it here. I have no aspirations of leaving, and you never know, maybe I'll be on the 40-year award one of these days.
I can't believe it. I've been here for 25 years and I enjoy working with my patient. I've been loyal or enjoy, and I love working with my co-worker. They're very nice. We always help each other. We always have a teamwork. I'm planning to retire here in this corporation because I enjoy working here.
When people allow you into their lives in happy times, it's really easy. But when they allow you into your lives in the hard times, that's really special. And those are very, very memorable moments for myself. You cry with them, you care for them. That's the compassion. I talk about nursing has become very, very high tech. But I hope nobody ever forgets that nursing is very high touch. I love community because I love the people, I love the patients, but it's become like family to me.
In my current job, I just absolutely love being the man in the shadows. And I like to tell people if I can retire someday and no one knows my name, I know that I did my job correctly, because no one knows who to holler at whenever something's not working. That means I got everything taken care of, and no one ever had an experience when it wasn't working. And probably one of the most exciting things I did was was taking a lot of laser equipment down to Mexico many years ago, and being the one to get the first 5 lasers, the eye lasers, into Mexico and putting them into use in hospitals down there. And as part of that, I actually got to work at Mother Teresa's orphanage down there, working on patients, and actually did some surgery on the front steps of the orphanage one day.
I was born here at Fresno Community, and I am proud to be an employee. I am a part of a 3rd generation. My mother worked here, I am working here, and my eldest daughter is also an employee. Mom worked in housekeeping. My daughter is a clinical nurse, postpartum at Clovis. The fact that it is a facility whose mission is the greater community, small c, that it is nonprofit, but the mission of the organization has always been something that I can embrace.
It's always memorable when someone gets really excited and joyful as they are able to do something they haven't been able to do before. I've had people become very tearful with tears of joy that they're able to walk again. I try to put myself in their place and what it must be like to have such a dramatic change in your life. So I really try to listen to my patients. They've taught me a lot over the years.
So we've come from running a dark room to having digital images now that just go to the computer and go to the doctors. I remember doing CT in the early 70s, and the CT procedures were just as slow as an MRI. Well, maybe not as slow, but it was slow compared to now. Community is a good place to work, because of all the expansions that they're doing.
I was a staff nurse on 3 East, and at that time there was a patient that had a fetal demise. About a year later, she sent her husband down to get me, and they said that I had helped them so much, and in the most difficult time they wanted to share the birth of their new child, and they wanted to have me share in a happy part of their life because I had helped them so much. So here I'm born at Clovis Community, the old Clovis Community. Then I'm signing a beam of the Heart Hospital, which is the future. And here I am working at Clovis Community, sort of where I started my life. It's just very rewarding.
I'm on the 8th floor doing the open heart floor, and I love it. It is absolutely one of the best things. It's a lot of education, teaching people how to move again and how not to blow open their stitches, and you meet wonderful people. Great place to work. And great people to work with.
That's what I like about ICU, is that I have 2 patients, and they're my patients. I know everything that's going on with them. When I went back to school to be a nurse, I wasn't planning on becoming an ICU nurse. I actually went back to school, I wanted to be an OB nurse.
started at the county hospital with the county run environment, and then subsequently transitioned into community medical centers, but yet remained at University Medical Center. But when we moved University Medical Center to CRMC, or Community Regional Medical Center, she agreed. She could have retired if she wanted to. She is the helping hand to many physicians, residents, fellows, not only helping them in terms of finding materials, but also doing beyond the call of duty to make sure that whatever clinical information is sought for is being received in a timely fashion.
Folks that work here, and in particular with community medical centers, are very proud of the length of time they've worked for the company. And I think that pride shows through on our product and the way we treat patients and the way we feel about our communities.
I think it's great that we have the corporation puts on a celebration for us every 5 years.
I'm excited.